I'm Dr. Chase Hayden from the Hayden Institute, where we help our patients become healthy and well without the use of drugs and surgery. Our last video we talked about celiac disease and the diagnosis of gluten sensitivity and how it relates to celiac disease. But what if you have gas, bloating, diarrhea, constipation? You feel weird after you eat something that has gluten in it, like wheat, barley, or rye, but yet your doctor, your gastroenterologist, tells you that you're negative for celiac disease. That may mean that your blood test comes back and you don't have an antibody response, or you had a biopsy of your intestines and everything looks perfectly fine. Yet we have a disconnect. You, as a patient that eats those foods, may feel symptomatically different, but yet, medically speaking, you're normal. That's an unfortunate situation for many patients when they come into our office. What happens with gluten sensitivity is, when we're checking for celiac disease, there are only two blood markers that we use, and those are related to alpha-gliadin. But the wheat molecule in real life, whenever we eat bread or pasta or wheat or barley or rye or something like that, doesn't just come in the form of alpha-gliadin. Gluten is a general name that we use to describe the protein in wheat, but there are others as well that your body could create an immune response to. This includes the wheat kernel itself, alpha-gliadin, gamma-gliadin, it could be one of the glutenins, it could be gluteomorphin, it could be a wide variety of other components of the wheat molecule that when it comes into your body, your immune system reacts to it, and therefore gives you symptoms similar to someone that has celiac, even though you traditionally do not have the diagnosis of a celiac disease. So how would we test for that? Certain research labs have gone through and done blood testing for the other components of the gluten or the wheat molecule. So therefore, we could have an immune response to wheat, we could have a response to gluten, we could have a response to alpha-gliadin, to gamma-gliadin, to glutenin, or all these other different particles of the wheat molecule. One of the best ways to test for that is using a lab called Celiac. It's a lab based out of Arizona, I believe, where they take the blood and they test your body to the various components of the wheat molecule. They're able to test 24 different ways in which your body could be sensitive to wheat. They're the most common 24 that they've come up with. There are certainly others, so your body could react to a variety of different ways. But in our office, we use a lab called Celiac, where we test patients for multiple different ways in which the gluten and wheat molecules could be affecting them. And it doesn't have to mean that they have celiac disease because of it, but yet they can be testing positive for gluten sensitivity. This is the best course of action for us to help identify the true cause of why someone may be reacting to breads and pastas, or having difficulty losing weight, or these digestive issues, or headaches, or thyroid conditions, or these other common symptoms that relate with gluten sensitivity, even though their other doctor has already told them that they're not celiac. And it's very common to have a non-celiac patient still react to gluten. And the best way for us in our office to figure this out is to use the Celiac testing. So we encourage you to be tested. Many doctors across the country offer Celiac testing. It allows you to look and see what other portions of the wheat molecule may be creating your symptoms through the immune system. I'm Dr. Chase Hayden from the Hayden Institute, where we help our patients be healthy and well, and without the use of drugs and surgery.